Today, we're here to share with everyone here what we have and what we know about early intervention, both from a data perspective, but also how we're using data in ways to impact not only advocacy, but community level change. And so throughout this presentation, you'll hear both a number of ways in which we are doing that, not only from members of CCC, but also from our partners at United for Brownsville. To introduce our speakers just for a moment, from CCC, we have Maria Drobniak, who's our Senior Research Associate, myself, Carlos, who is the Senior Community Outreach and Engagement Associate, and Jenny Veloz, who's the Policy and Advocacy Associate. But I'd also am excited to introduce our partners in this work, United for Brownsville, which is an organization that's led by families, social health and educational service providers in the Brownsville community. And they've been really spearheading and leading the way on their numerous community first leadership initiatives, including their important work around early intervention to really solve complex issues like this and disparities that they see within their community in relation to early childhood development outcomes. So you'll hear later in this presentation, and then when we have time for open discussion from the audience and to hear your questions, you'll hear from Danielle Herring, who's the Early Intervention Ambassador, Ruth Horry, who's the Provider Engagement and Access Manager, and Micah Venture, who's the Deputy Director for Systems Change. So I just want to give a big shout out to our partners at United for Brownsville and to our CCC team representing here, because this is going to be an amazing conversation and I hope something of meaning and value for all of you here. I'll go through these slides really quickly because I want to spend a little bit of time, more of the time focused on the work that we are doing, but just to briefly recap, we are a child advocacy organization for over the last 75 years have combined public policy, research and data analysis with community action to ensure that every child in New York is healthy, housed, educated, and safe. And we take a multi-pronged advocacy approach by elevating voices of children, families, and community members throughout these three pillars of our work. Our advocacy is fact-based and deeply rooted in data and policy analysis and coalition building across multiple issues that impact child well-being, child and family well-being throughout New York City and New York State. And we really strive to empower New Yorkers to be advocates through many civic engagement programs and making sure that our data, which continues to be evergreen, is available to the public. And one of the reasons why we're excited to be sharing the resources that we have in a space like this today. We'll share some links and you'll see some of the highlights of some of our numerous research and data resources, but I just want to highlight that we produce a number of annual publications, fact sheets, infographics, and community-based assessments. But really, one of the key highlights and a powerful tool that is also available is Keeping Track Online, which has been our signature resource for the past 10 years, increasing to over 40,000 users. And a way in which we engage our audience into broader advocacy work that is happening within our organization. So we really see this as a key tool that can further strengthen our advocacy and numerous ways in which different stakeholders, members of the community, and advocates such as yourselves can be of resource and value to your work. So with that being said, I want to pass it off to Maria, who will talk a little bit about the early intervention program and what the data is telling us about that program citywide, as well as in some local efforts underway. So Maria, I'll pass it off to you.
Thanks, Carlos. I was about to say. Thank you everyone again for joining us today. And thank you, Carlos, for the great introduction. My name is Maria Drobniak on the CC's team. We are very happy to be here today and share more about our work in the early intervention space in particular, among many other domains that Carlos already talked about. So to get us started on the next slide, I'll just share on the next couple of slides what is early intervention. It is really a program that provides services for children under the age of 3 with developmental delays or disability. And the program helps children to learn, play, grow, talk, or walk like other children of their age. Some of the most, on the next slide, you have some of the most used early intervention services. So kind of it's important to keep them in mind as we are going through the presentation. And some of the most common ones are speech pathology, special instruction, occupational therapy, physical therapy. So keeping these services in mind, as well as with the age of the children, like children of 1, 2, under 3, is important as we are kind of talking more about the system and how children progress through the through services. So on the next slide, I'm kind of outlining a couple of additional things to keep in mind. Children who are in need of EI services are federally entitled to them. So that's like something to understand to begin with. Services are free and they don't really take into account income or immigration status. And children typically receive services in at home or daycare setting, but during the pandemic, telehealth was used. So my colleague Jenny will talk more about that. And children in need should get services as early as possible. That is really critical, and every delay is actually detrimental for the child's development. And we don't want any child left behind in a city. So with this, I'll transition to some of the data that we have available in early intervention space. On the next slide, Carlos, we know that New York City Department of Health and Mental Hygiene, Bureau of Early Intervention, is really in charge of the early intervention system in the city, and they provide 2 very valuable data resources. One of them is New York City Local Early Intervention Coordinating Council. The report that we have on this slide, I have a link. It's released 3 times a year. And what is really important, this report has the data over time, like back to, I think, 2013, having several indicators, including how many children are being referred to services, how many children are getting services, and the rate per 1,000 children under 3, which is important to understand the scope. There is also data in this data set on how children progress through different steps, and I will talk about that more on the upcoming slides. And it is important that through this data, Department of Health really pointed out into the drop of the children who are actually being piped into the early intervention system throughout the pandemic, which then gave us the data to really advocate for changes in services during the pandemic. In addition to this source, we have another source that actually we started having in 2020. It is New York City annual data on early intervention to the City Council. It is pursuant to the local law 22, and report provides additional data on indicators I already mentioned. So in addition to the data on the referrals, evaluation, the receipt of services, we have it broken down by the race, ethnicity. Bureau of Early Intervention provides breakdown by gender and the language. Data is not available just citywide, it's available for all zip codes in the city. So it is really important added values. So organizations like ours, also service providers, can really understand what is happening in their communities. And what is really valuable, and we will talk more about that, is data on timeliness. There are several indicators on timeliness that kind of tie into the progress through the EIS services. And I'll say, while I'm actually speaking about the data that we have in the city, it's important to say that on the state level, we don't have this granular level and tracking of early intervention services. It's a mix of, like, the tracking is not really mandated on the state level. There are many staff shortages across the counties. So that is something that we advocated for in the previous year, and we kind of continue to elevate because it's important to understand statewide as well. And I will dive into a couple of data points just to illustrate the state of the children in early intervention services. So on the next slide, we have, I'm just outlining that citywide around 30,000 children under 3 are getting early intervention services. It is around 10% of all children under the age of 3 in the city. And on this chart, we see the breakdown by racial ethnic groups, and we do see some disparity. If you focus on the 2021 data, this is a rate of children under 3 within each group per 1,000 children. So we see that white children are getting services at a higher rate compared to, for example, Black children, who are like, we have 109 per 1,000 getting services among white and 72 out of 1,000. However, what is important also to note is the progress throughout the time. So we see that the rate for all children, like especially Black and Asian, increased over time. So there were like 65 children, Asian children getting services in 2013, 65 out of 1,000, and that kind of increased to 89 out of 1,000. So there is a conscious and concerted effort on the program side to really increase equity in early intervention space. And on the next slide, I will walk you briefly. I explained that progress statistics, how we call it, the waterfall, like how children progress from being referred to the system, but to getting services is not very straightforward. So I think how families are able to navigate the system and what are families' perceptions and interactions with different pieces of the process is important. So maybe slide, Carlos, if you want to click through. On the referral side, it can be made by the doctor, nurse, the counselor, therapist, parent themselves. There are many questions that come here, like how many children are actually being referred to services is important, like who is the one observing the delay and making this connection. The next step is evaluation. It really can be done only if parent consents. It is done by evaluator who looks at child's overall development for delays using child's native language. So this kind of space between the referral and evaluation is one space that we actually focus on, and you will see it on the following slide. And then the third step is eligibility. If a child meets strict guidelines for delays, it is deemed eligible for services. Ineligible children can be monitored and referred again to the system. And then the fourth step is really if child is eligible and parents consent. So there is a parent consent throughout the process. They continue to get services up to age of 3. So on the next slide, I'm pulling the data from that first data source that Bureau of Early Intervention produced, the progress statistics. And here I feel like that there is a lot of data, but just to keep in mind, these blue bars are those showing the total number of children being referred in the system. So if I focus just on the bar, on the first set of 4 bars on white children, we see that over 8,000 are being referred. The red bar is showing that 91% of those are getting evaluation, and then 60% of 8,000 is found eligible, and then 58% get services. So this is the dynamic for white children. But then if you focus, for example, on Black children, we see that overall fewer children are actually even being piped into the system, 4,600. But then of those 4,000, 81% are being evaluated. So this is like one question, like why not more children are being evaluated? And that is something that we are trying to unpack with our community-based work that Carlos will talk about. And then that second point, like if we have 55%, like over 2,000 children being deemed eligible, I'm talking about the Black children, why not all of them are getting services? So it is that second point that we are kind of thinking about as we are unpacking the data on a local level. And on the next slide, I'll just move on from this one, and Carlos will spend some time on this data. But I'll just, I mentioned already the timeliness and indicators that we have in the annual data that BI produced annually. So this on this chart, I included a screenshot from the Keeping Track Online database that Carlos mentioned. So we are uploading data that BI produces in the reports on the database, and on this one we see timeliness of getting services. So some children get all their services within 30 days, some children start getting some services, and there are children who get no services. So you can explore all of this data, and it's really important for us to monitor these indicators. And on the next slide, we have another timeliness piece, which is about timeliness of receiving that initial IFSP meeting from the referral date. So it is happening that first batch in the beginning of the process. It should happen within 45 days, but for many children, it happens after 45 days. So it's one aspect of delay. So we can see the data by race ethnicity on this slide. And these and many other indicators can go through the next slide. I just included a screenshot for the Keeping Track Online database. You can explore many other data across different domains, demographic, economic conditions. But if you navigate to health and mental health, you will see this subsection on early intervention. So you can go there. And as I said, many of the data on EI are now available by zip code, which is very valuable. So you can click on the next slide, Carlos. So you can explore those, and we continue to update the database as the data is available from the Bureau of Early Intervention. So with this, I will pass it on to Jenny, who will say more about our policy and advocacy efforts. Thank you.
Thank you, Maria. So as Maria, thank you for having me speak on this. So as Maria illustrated throughout her presentation, data helps guide the advocacy work that needs to be done for early intervention and ensuring that children who need the services receive all the services. And there are many challenges within the EI system that make it difficult for children to receive those services. So on the next slide, we'll see what are those challenges within the early intervention system. So as many of you may know, EI rates are set by the state, by New York State. And one of the primary challenges in the EI system is that the rates are way too low. So when the rates are low, it leads to provider shortages in the state, which then causes delays in services for children. So there hasn't been a rate increase or COLA increase in EI rates by New York State since before the pandemic. And even though there was a modest increase for some services in 2018, New York State has not seen a significant rate increase in over 20 years. And because children 0 to 3, it is a very critical time for brain growth and development for children. Any delay can impact a child's progress and their ability to thrive and to reach their full potential. So just specifically in New York City, overall, 97% of children initiate all or some of their services within 30 days of their initial IFSP, which is the legally mandated time frame. But less than half receive all of their services within that time frame. Black and Latinx children, as was illustrated by Maria's presentation, are disproportionately impacted by these delays in starting their services. For example, 42% of Black children and 48% of Latinx children initiate all of their services within 30 days, compared to 60% of white children. So Black and Latin children of color disproportionately are receiving all of their less than half of Black and Latinx children are receiving all of their services or starting all of their services within that 30-day time frame. And what we're also seeing is that children are waiting 30% longer to start any EI service. And which results in an increase in average wait times, which is illustrated in the next slide. So as you can see on the average number of days from the initial IFSP meeting to the first EI service, in fiscal year 21, for Black children, it was 17.7 days. And that rose the following year in fiscal year 22 to 24.9 days. And you also see that with Latinx children, where in FY21, they waited 17 days to initiate a first service or to start a first service. And that increased to 24.2 in fiscal year 2022. And you compare that to white children who on average were only waiting 13 days in FY21. But that also increased far less than Black and Latinx children to 16.3. And on the second chart, you see the percentages of children receiving some of their services, all of their services, and none of their services within that 30-day time frame. And as I mentioned in the earlier slide, Black and Latinx children receive less than half or start less than half of all of their services within that 30-day time frame. So if we go to the next slide, how can we improve the early intervention system? The early intervention system needs a lot of improvement. So CCC is a member of the Kids Can't Wait Coalition, which is the statewide coalition advocating on improving the EI system throughout New York State. One of our major priorities, especially for this budget season, is to advocate an increase of an 11% provider increase in reimbursement rates, which we believe will help with provider shortages. So right now, New York State is in its budget season, and we were pleased to see that both the state and the assembly supported an 11% increase for provider rates. But we are going to continue to fight and advocate and work to ensure that that 11% increase is included in the final enacted budget, because we really do need to urge New York State to increase these rates so that we can address provider shortages. So during the height of COVID, when everything was shut down, it was great to see that telehealth was an option so that there wasn't a gap in services for children who really needed them. But we also need to make sure that with everything opening back up the last few years, that there's equitable access to in-person and to telehealth services, so that children who need the in-person services are able to get those in-person services. It's really important because families of children who need services like physical therapy, occupational therapy, would benefit more from the in-person services than from telehealth. But there needs to be a balance. There are many families who do prefer telehealth services, but there are also those families that really want in-person services, because especially when a child is a toddler, 1 or 2, it can be a little difficult to try to do physical therapy or to do occupational therapy or through a computer screen or through a monitor. So we want to make sure that there's a balance between access to in-person and telehealth services and make that equitable so that the default option is not telehealth, and so that families who prefer in-person services do not have to wait longer for that service. Excuse me. So in regards to this equitable service, we also have to ensure that children who need in-person have access to them by including institution of enhanced rates or rate add-ons to address extra costs associated with the delivery of in-person services, such as transportation. And what we also must make sure that we do is that those rate enhancements target underserved communities in New York State, especially low-income communities of color, who continue to be impacted the most by the lack of in-person services. So as we'll see in the next slide, we also need to make sure that there is support for a cost study bill requiring New York State Department of Health to conduct an assessment to determine payment for EI screenings, for evaluation services, and service coordination, because what we need to make sure is that the rates match the need. And this bill, this cost study bill, will help assess and make sure that the rates are matching the need of the EI service providers. And of course, one of the most important aspects is to support community-based efforts to address disparities in access to EI services, which Carlos will speak a little bit about. But just to conclude this section, I want to just say that, as you can see, data tells only part of the story about the challenges within the EI system. We still look to you all, to providers, to caregivers, to parents, to our community partners, to complement and guide our advocacy work around early intervention. So before I kick it over to Carlos, I'm just gonna talk a little bit about some of the resources that CCC has done in regards to early intervention. So on this next slide, you'll see that CCC produced an EI fact sheet on the timeliness of services for EI. And in the fact sheet is a lot of the information that Maria went through and that I went through in regards to the delays in service and the racial inequities and disparities within those delays. And that fact sheet resulted in CCC being interviewed in a political article on EI delays. And we also published a blog post on our website around the delays of services within the EI system. So on that note, I will turn it over to Carlos to discuss our community level work.
Great. Thank you, Maria and Jenny. And I appreciate kind of the wealth of information. I keep on learning every time I hear either and the both of you speak about early intervention and the impact that's having both at the city level and the statewide level. But I want to bring it back down before we introduce kind of our partners at United for Brownsville, kind of set up a little bit about this community level change work that's happening, and really reemphasize how the work that's happening in United for Brownsville and that we're about to share with you here as well is really centered around ensuring that both caregiver and community voice is at the center of driving both how we understand what is happening in our communities, in our different neighborhoods throughout New York City, and why they are the drivers for change, really long-lasting change to happen, and really emphasize the advocacy work that is happening in our organizations and the different coalitions that are really advancing this work at the policy and legislative level as well. I always like to talk, and our United for Brownsville partners will talk about this too, but community voice is also expertise in the initiatives that we're having in partnership with them. And as you'll see evident through their own work, engagement of parent and caregivers from multiple regions across the state in campaigns that are reflective of not only coalitions models, but mobilizing people around these issues is critical. We want to make sure that we provide caregivers and families who are most impacted by these inequities with a seat at the table to set priorities and drive activities. And we also want to ensure that our priorities are grounded in the expertise and the lived experience of families who are impacted by issues and disparities that we see in early intervention and other critical services that families and young children are receiving, because they are really, in essence, the experts who are going to become the leaders, I think, in this movement of the change that we are creating here. And so those are kind of, some of the values that we want to make sure is incorporated into these initiatives as we think about how we can advance equity within the early intervention program space. We have had this partnership with United for Brownsville because of the work that they've really done to advance early intervention equity within their communities. They'll be sharing in a little bit about the work that they are doing, but since they've launched their own efforts, we have come together to think about how we can advance EI equity in other communities throughout New York City, where we see participation is disproportionately low, whether we do this by increasing referrals or retention in the enrollment process. And what we are doing in partnership with our various partners listed here is looking at this community level data that's provided in partnership with our groups, have local stakeholder conversations about what the data is saying. So that way we're not getting only the quantitative data, but the qualitative data, the community voice, what their experiences, both from a parent, caregiver, or a provider perspective, is saying about what is happening in relation to EI services and EI access in their communities. And we hope that, by having these conversations, we can identify ways and new strategies to have community-led interventions improve EI enrollment rates and really address inequities that are existing. And like I think I've been echoing multiple times already, take this community-driven approach where we do put parents and caregivers at the center of this work. So you'll see we are also doing this in partnership with the Department of Health and Mental Hygiene. The New York City Bureau of Early Intervention provides data with us and outreach resources to partner organizations working in this partnership to increase participation and retention in the program. And this partnership really wouldn't have been possible without the support of DOHMH, because additional data is being provided to us that tracks on a zip code level information that informs both the planning and the progress being made by the strategies we're adopting. And so just to highlight the communities that we're working with in Hunts Point, the zip codes that we are working with here alongside the Hunts Point Alliance for Children. In Northern Manhattan, the Northern Manhattan Early Childhood Collaborative, which is a collective impact group supported by New York Presbyterian and Literacy Inc. In the North Shore of Staten Island, we have partners, a partnership with the Staten Island Alliance for North Shore Children and Families. And in the South Bronx, we have South Bronx Rising Together, who's our partner in elevating this work there. So just really briefly before I pass it off to our colleagues at United for Brownsville, we are taking what Maria has been discussing about the waterfall effect and spaces in which we can address needs and equities and improve access to families, and doing this at the local level. And here's kind of an example here of some of the data that's been provided by the New York City Bureau of Early Intervention. And we're using this data, this zip code level data, to really show how we can identify different outcomes that aren't explicitly shared from the citywide data that you saw earlier, and using and kind of looking at this, for example, under the evaluated bar, we can really see how we start to see different outcomes dependent on geography, but also by race. And that provides us with more information and begs us to ask the question in these groups and in the partners that we're working with to examine why is there these disparities in the case of families who are getting evaluated for services, and in this other instance here, receiving services as well after they've been identified as eligible to receive those services. And so, you know, all of this, this process and this initiative that we have underway, a lot of it is about relationship building, but also thinking about what resources can we share and provide within our communities. How can we mobilize our communities so that way they are part of the conversation and informing and driving what we need to do to address needs, barriers, and solutions. And really thinking about what is it going to take to get to that community level change to see improvement in equity and outcomes for young children and families. And with that being said, you know, I'll pass it off now to our colleagues at United for Brownsville to both introduce themselves and really concretize how equity can be addressed in the early intervention program, and how bringing in community can lead to long-lasting impact for parents, for families, for caregivers, and for young children. So Micah, I'll pass it off to you to start and take things from here.
Sure. Thanks so much, Carlos. I am Micah Rencher, and I am the Deputy Director for Systems Change at United for Brownsville. And to start us off, I'm actually going to pass us over to Ruth to share a little bit about the brief history of United for Brownsville, how we got started with EI work, because Ruth just came back from South by Southwest where she did this. And I think that it is really important in understanding why we do the work that we do. So I'll pass it over to Ruth.
Hi, everyone. Good morning. It's giving me trouble unmuting. My name is Ruth Horry, and I am the Provider Engagement and Access Manager with United for Brownsville. And so I guess I'll start with my role and my position. And so United for Brownsville came together and brought the community, the families, 21 to be exact, of Brownsville families that were invested in their community and wanted to have that seat at the table so that they could get the voices of the community out. And so I was one of the original ones to sit around that table. And one of the things that just kept coming up for us was our experiences with early intervention, and just proof of the collaborative effort that United for Brownsville stands for, as well as amplifying community voices. I started off as a provider, a family advisory board member, which just required monthly meetings and being able to have my voice heard. And that has turned into now leading on the backbone team working with United for Brownsville. So it really was a seat at the table. It wasn't just, we want to hear what you have to say. We're going to use that and move on. We really still are leaders in the community. And so again, as I said, early intervention was something that just kept coming up, and there were just such drastic differences in how you were able to receive and utilize the service. And so for me, I had a unique experience because I had two children in two different areas in New York City, one in Queens, my oldest child, and for some reason, early intervention was just thrown at us. I honestly thought it was something that every child received. And so moving out and getting my first apartment and having my second child, what I could afford was an apartment in Brooklyn. And so getting in that space and now noticing some delays with my daughter and the back and forth with the doctor and them not pretty much just disregarding me. I heard comments like, stop reading those baby magazines. And so I had that fight on one side, and then her father on the other side, just not able to accept that something could be wrong with his one and only child. And so the fight back and forth to get a service that I didn't know what was wrong with her, but I knew something was wrong. And then when we finally got the doctor's okay, which at the time I didn't know a parent could make a referral, the lady actually came out to the house. I happened to be at school at the time because I was going to college and working. And as I was coming home, her stuff was being thrown out the front door. She was being kicked out. Dad was not on board with any evaluations. And so I say that to say that she missed services. And she is 16 going on 17 this year. And it has been a roller coaster of hell ever since for her in terms of her social emotional well-being and all of the things that were missed and the services that she could have and should have and was entitled to receive. And so that's what drives this work. For me, it's that no family, parent that moves into the community doesn't have access to the resources that they need. And so a big part of my job is also to connect those resources and make sure that they flow seamlessly throughout the community, because there's no point of having a resource if no one knows anything about it. And so the work that we've done with United for Brownsville in terms of early intervention was to wrap around and support the family and also to support the providers that are overworked and underpaid. And so everyone came to sit at the table. We got to hear from early intervention. They shared data, and we birthed the early intervention ambassador. And what was done with that, it's hard to put into words. The first ambassador had to do everything new. She didn't know what to do, but she knew she wanted to help. And we did that door to door, walking from block to block throughout Brownsville to make sure that her face was everywhere and that everyone who was interested in or needed more information on early intervention knew where they could go. It was a safe space that wasn't a part of any government organization. And so I'm really proud to have seen that happen and then to welcome Danny to the team and see her perspective and her take and her human-centered, emotionally intelligent approach to supporting families. And I've just seen that work over the past year. And I'm really proud of what we've been able to do in reaching families and getting those evaluations. And I just really look forward to the next part of that work is how do we amplify these voices of these families that we've got them. They got the evaluation, can't get the services. And so that's where I want to help. And that's where I'm most interested about how can this data help us and what can we do as community partners and how can we help amplify the voices of the families that Danny works with. And so I could talk forever about this because it's my life, but I will pass it back over to Micah to continue.
Thanks so much, Ruth. As we get to the next slide, I just want to, thank you, Ruth, for sharing your story. And, it's really impactful for the work that we do. So thank you so much. And as we look at this slide, I just want to point out and thank Jenny for mentioning that data only really tells part of the story, because as we focus on the first, the graph that we have here, we see that we're looking at the EI referral rate for citywide, but specifically we're looking at how Black children in Brownsville are doing compared to the citywide rate. And so this data from the Bureau of Early Intervention was really instrumental in helping us see where we were, right? So we see that there's a disparity between Black children in Brownsville versus the citywide rate, or even white children in New York City. And so we knew that we wanted to focus on that. However, that doesn't tell us why we're experiencing some of those issues. And so we really relied on the FAB, as Ruth mentioned, to kind of guide us through some of that questioning. So what is it that families may be experiencing as barriers? And so some of that came about in trust. And so that even came about in Ruth's story that she just mentioned. Some of that came about in having access to information, right? So there were different things that came about during those anecdotal conversations. And that was really helpful in us determining what our next steps would be, the kind of strategy that we would engage in. And so much of that work lies in the hands of our early intervention ambassador, Danny, who I am going to pass it along to now, because much of her work is instrumental in us seeing a shift. So at the end of the graph, we do see that the rate for Black children in Brownsville is pretty much at par with the rate of New York City children across the board. And so that is something that we're super proud of. And as we move on to the next phase of the work, which I'll talk about briefly after Danny talks, it's important for us to realize our successes and to see where that takes us next. So I'll pass it over to Danny as we turn to the next slide, so that she can talk a little bit about her role and some of those challenges that she saw that families were being faced with in Brownsville.
So hello, everybody. My name is Danny, as some of you already know, or we've met or engaged in a way. So the same way I walk this through with my families, I'm going to walk it through with you. I want to give you a little bit of information about myself first. Coming into the early intervention ambassador role was an added addition to where I've been. I am also a mom myself of a child who now has an IEP, and he is in the 7th grade. He started off in early intervention. Not only that, I am a veteran educator. I've worked with children from birth to 5 years old in childcare, and I also work with elementary, junior high school, and high school in a District 75 school. So the different roles for me were being a mom of a child who went through early intervention, being an educator who actually had to administer the goals of the services giving in schools, and now being an advocate and understanding how I felt and what that looked like in my role. So because I understood those pieces, I understood that in order to engage with families, you had to address the whole individual. And a lot of times we're even told that, when you're at work, you leave your other part, you leave your personal at home, but you can't be who you are without being who you're supposed to be and involving yourself. That's where the heart and the passion for this job comes from. So when I'm approaching families, or when I'm engaging with families, you have to understand, just as Ruth spoke about in her story, there are stigmas that are here where if I can even relate to your daughter's dad, like there had to be a stigma or an experience that was connected that made him want to reject the service. And when we don't address the things like that, it's almost like you're already dismissing the family's feelings. So empathy is what I engage with families first, empathy first, because there is a story that has to be told. In the midst of all of that, empathy, opening the doors with empathy first, it actually empowers families. So when I'm speaking to a family, I'm also making sure that they know that they are the CEO of this service, and this is a VIP service. Why do I decide to do that? Because I give them language that they're familiar with to normalize the service, so it already begins to erase the stigma. If you are the CEO of something, you feel like you're coming in as the boss. So if you are the boss, you are open to hearing everything because you know you get to make the major decisions. That's how I begin. That's how I begin explaining the service. A VIP service. Any single time someone hears VIP, you are special. You feel special, and you know, okay, I want to be a part of that line. I want to be a part of whatever that is. So now it opens the ears to hearing what the information is. Not only do I begin there, and this happens a lot families don't really understand the process. Yes, knowledge. Yes, we say things, but are we really talking to the family to engage with them, or are we speaking at them? I have had families tell me that they felt like providers were talking to them like robots, or when they were getting the information, they didn't feel like they can interrupt to say, hey, can you explain that? I don't understand. So we think that having the knowledge is one thing, but knowledge without understanding, there leaves no room for activation. So now families cannot become participants in the role. And what happens if a family starts off in the role knowing that they're the CEO, understanding the information, I can now participate and make informed decisions. So already my posture has changed. So I'm not coming in as someone you're telling what to do, but I am involved in the role. So what are we producing? We're producing advocates. So now coming into this position, sorry, I have my own notes. So if the families come in that way, things that I have recognized, the stigmas, families not being approached with empathy, not understanding the information so they can be participants in making the decisions. And now we're speaking about going through the process, families now being informed. I can have a conversation now about the delays that are happening because, as we know, Jenny, I believe that you mentioned it in the data, the delays that are happening in the services. Although there are delays, when families come in more as participants, they can help and assist in the advocating, and they're also able to hold on longer in the journey because they understand why they need the service. When families don't understand what's going on, they drop out of the service. When they don't understand what's going on, they not only drop out, but they shut down. And now that becomes an experience that families are marketing, like don't deal with EI because it's not a good experience. Something else that I've experienced, once families are actually going through the process, they don't receive the services. I heard many of you speak about this. And they're offered telehealth, right? I think, like you said, I believe Jenny said that as well. Telehealth is something that some families want. But even the way that I introduce telehealth to families, because families are like, my child is not going to sit in front. I tell them as they're looking for providers, then we choose telehealth because we understand the development of the brain and we want them to continue to go. But what I explain to families is that telehealth is not really for the child. It's really for them. Why? Because a child is not going to pick up what the individual on the other end is saying to them in 30 minutes twice a day. So if the family can grasp in that engagement, if they can grasp what the individual on the other end is sharing with them, then they'll be able to take that information and they'll be able to normalize the activity with their child while someone is still looking for an in-person provider. That's how I assist in the problem. Telehealth is an issue for many of our families because they already feel like, I can't do this with my child. My child is not going to sit in front of the service. And it doesn't matter if it's OT or even speech, even something that they can do online. Another thing with telehealth, something that a lot of families are talking about now, even for the families that were okay with starting telehealth, it's not engaging. It's not engaging. And I went through, when the pandemic hit, I was working in a school system. We had to start online. There are things that you have to do to be able to engage with children and even with families to hold attention. It is possible in some instances, but that's something that also needs to be addressed. There are situations in telehealth where providers are checkboxing, or they're not really speaking to the child, but they'll put on videos, things like that are happening as well. And that was something that multiple families have spoken to me about as well. And when families would want to say like, hey, like, what can we do to help you? Because they don't really like this, they are not being heard. Their voices are not being heard. Receiving services on time, that is also a barrier. So now after we've gone through this champion, getting the service and going through this process that's only supposed to take 45 days, but it's not happening in 45 days. Now I have to wait longer longer than 30 days just to receive not just one service, but sometimes all of them, because some families, again, do not want to deal with telehealth because they don't feel like their child is learning from that. Okay, I think that's all I have so far. But I also want to leave you guys with the champion story that I received today, and I want to share it because of the issues that that I've named and things that we've been experiencing, I created a form, almost like a checklist for my family, so they don't always have to feel like they have to call me, but it's something for them to keep track. And I spoke to a parent today, and she hasn't been calling, just signed her up recently, and she's going through the process. She hasn't been calling, but she said, Danny, I didn't have to call because you gave me everything I needed. I had it in front of me. She was able to go through the list on who her providers were, tell me who was her service coordinator. This is not something that parents are normally able to do. She was able to list everything and where she was in the process because of the tools given, but it was because how she entered into the program. She came in empowered. And because she came in empowered, because all parents that come to the program want the best for their children, then she's able to be successful. So now we're just waiting for the ending results. Okay, I'm finished. Thank you.
Thanks so much, Danny. If we can move on to my final slide, I will summarize it as quickly as I possibly can because I know we're kind of out of time here. So with all of the work that Danny does, it's great that UB has Danny, but much of what we tried to do is to extend her reach. And so we were able to extend Danny's reach through some of the things that we do in the EI Equity Working Group. And I see a couple of people who joined the call who are actually a part of our EI Equity Working Group. So hi, Rob, and hi, Noura. And I do know that a part of what we did with the EI Equity Working Group was summarizing a lot of what Danny just said. So taking the way in which she talks to families and seeing if we can replicate that at other institutions. So the EI Equity Working Group was really instrumental in turning those conversations into a conversation guide, which I like to call Danny's conversation guide. And we utilize that to help other providers engage in that conversation with families, especially because some of these same families are still experiencing issues with trust, lack of information, so forth and so on. And as a part of that work, we actually do have one organization that is in the process of adopting the conversation guide. So at Health and Hospitals, we will be doing a training in April with the community health workers to train them, so to speak, with in terms of utilizing the conversation guide and hopefully adopting it from there. So that is in one way extending that reach out into the community so that more people can experience some of the same successes that we are. And then we also are partnering with the Bureau of Early Intervention to lead a service coordinator training. And that's more so a part of the next iteration of our work. So we focused a large part of the work that we did at UB with the referral piece, and now we're looking at what can we be doing to make steady strides in improvement as it relates to the evaluation piece. And so a part of that can be seen hopefully in the future work that we will do with future trainings. And so given that we were out of time, I am going to leave it at that. And thank you all for joining this conversation today. And thank you for allowing UB to share some of our success and to share some of the work that we're doing in the community. Thank you, Carlos. And thanks, Ruth and Danny.
Yes, thank you, Micah, Ruth, and Danny. I was totally okay with hearing all of you speak for the rest of the time because it's not only so inspiring, but you really are, like I was saying in the chat, passionate about being champions for families and really putting them at the center of all the work that you've done. And I think our goal, and hopefully this work continues in Brownsville to expand and really reach not only your community, but other communities throughout New York City, and following kind of the practice that you're setting here today and for the last few years. So I know we're out of time. Zachary, let us know if we can spend a few more extra minutes getting any questions from folks, but we understand if folks need to leave, we'll circle back with you via email on all the information that was shared here today. You have our contact information on this screen here, which we will also be sharing following this event, and we'll share the slides, materials, a recording when it becomes made available. But Zachary, yeah, we can stick around for a few Q&As. I don't know, Zachary, if you want to step in now and provide your message while I ask members of the audience to kind of raise your hands if you have any questions. We can unmute you or put it in the chat to see if there's anything you have to ask of any of our speakers today.
Yeah, well, thank you again, Carlos. Thank you again to the Citizens committee for the children, and thank you so much for United for Brownsville. That was a wonderful session. I will say again that we'll have videos of all of these sessions posted on our website, and we do have events continuing to come up this weekend. But with that, and to leave some time for Q&A, I'm just going to put a bunch of links in the chat. And if you have any questions, feel free to message me or to visit the Open Data Week website and reach out to our team.
Okay, thank you, Zachary. So again, for the speakers too, if you need to go, we understand, but for those who can remain, we do have some folks who have some questions. So Liana, you should be able to unmute yourself. I just sent you a message. Feel free to ask your question and point out to a specific speaker if you have a question specifically to someone.
Okay, great. Thank you. Thank you, Carlos. And thank you all for the presentation. Very, very interesting. My question is sort of around the provider community. I know that you're targeting a lot of efforts toward increasing reimbursement rates. And I'm wondering about also efforts to utilize the private insurance market to increase rates and pay more, pay more of a fair share toward providers. So I'm just kind of curious how you're kind of looking at the provider community and sort of the challenges that they face in terms of entering the space to provide services, and sort of what can be done to continue to kind of correct some of the market dynamics in that area.
So I think if I can jump in and pick someone, Jenny, if you want to go first with that, and then if any of our other speakers want to add to what Jenny is sharing, feel free to. Or did Jenny?
Yeah, oh. I'm sure. So I think that part of that, I can answer part of that question just by saying through the Covered Lives legislation, there is money that is being put in, private insurers are putting money into covered lives. And the hope and the wish is that for the money that's in there to help cover provider rates and address the shortages that are going on in the provider system. I will also defer to my colleague Alice, who's on the presentation. But I would say that we're looking at all aspects. We're looking at the state increasing reimbursement rates. We're looking to have the money currently in covered lives help with provider rates also, to address the shortage that's going on.
Great.
And hi everybody. I'm Alice Buff, and I work with the CCC team in the policy space too. I think Jenny, I would, I think that was spot on. Is I think that, for those of you familiar with Covered Lives, the idea behind it was to really try to get insurers to pay their fair share, because they so overwhelmingly were denying claims for EI services. So that did get through, but what our hope was that funding would get reinvested into the system, and instead, it really hasn't gone back into supporting things like rates, or really even supporting, and now that money is not necessarily going to counties anymore. So I do think we've identified that pot of money as a way to look at things like rate increases, especially when we have a state leaders who are saying there's no money for anything. It's like, well, there's actually some money sitting right there that you could use and reinvest into the system. So I just echo what Jenny said, that's one of the areas we're looking at.
That's great. Thanks.
Great. Thank you. Do we have any other questions from the audience? You should be able to unmute yourself, so just feel free to do that. Okay. I'm not seeing anyone unmuting yourselves or raising your hand. So if there's no other questions, then I guess one final thank you for all of our speakers today, especially the team at United for Brownsville, and for everyone joining us here today. Like I shared earlier, we'll follow up in an email with all this information and how you can reach all of us if you'd like to connect more about the initiatives, the data, or the advocacy work underway. And again, one big thank you to the New York City Bureau of Early Intervention, who's been partnering with us on this. I don't see on the call here today, but has been instrumental to this work. And final shout out to the New York City Open Data Week team as well. So enjoy the rest of your Friday afternoons, everyone. have a great weekend, and hopefully we'll be connecting with you again soon with this work and how you can be a part of it. Thank you all. Thank you to all our speakers, and have a great evening.
Thanks, everyone.
Thanks, everyone.